need a pacemaker?
So there's several reasons. The most important reason is for a condition which is quite important, which is called cardiac syncope. And essentially, cardiac syncope is when you have syncope because there is a cardiological cause. There's something wrong with the heart that leads to syncope. And generally, when that happens, one of two things in the heart goes wrong. Either the heart is too slow in a condition called bradycardia, or the heart is too fast in a condition called tachycardia. For a pacemaker, the condition of bradycardia is the most relevant. We can talk about tachycardia in a while, but if you are offered a pacemaker, it's typically because somebody or one of your doctors has done a monitor for a prolonged period or done an ECG and seen that the electrical conduction within your heart has the tendency to slow right down, for example, with a 3, 4, or 6-second pause that may put you at risk of abruptly losing consciousness without warning. And so if you're offered a pacemaker for that reason, with syncope from a slow heart rate or bradycardia perspective, I think it's very important you listen to your local doctor and take the advice and have a pacemaker.
Okay, so it's for a problem with the electrical supply of the heart that makes the heart go too slowly or even stop, and that can cause the person to black out and have syncope. So what can a patient expect when they come into hospital for a pacemaker?
So a pacemaker is a very commonly done procedure, which is very safe. It takes about 45 minutes to an hour to do, and it can be done under local anesthetic very easily. And essentially, the typical place that a pacemaker is inserted is just underneath the left collarbone. So where I'm indicating here, probably 2 finger breadths below the left collarbone, is where you'll have a 1.5 to 2 inch incision made under local anesthetic. Now, the feeling that you might have is as you lie on the cath lab table with lots of people around you to support the procedure is one of awe and trepidation, but actually just know that actually the people doing the pacemaker are very experienced. These are called the cath lab teams, members of the catheter laboratory who are highly drilled and trained in putting pacemakers in. Your physician will talk to you about it, and then if you consent, come to the procedure, give you local anesthetic, and then put the pacemaker in by finding, first of all, veins that drain into your heart. And so we put 2 pacing wires or pacemaker electrodes or leads from this area just below the left collarbone directly into your heart through the big vessel that drains into the heart called the vena cava. And typically you will have 2 leads, one in the right atrium and one in the right ventricle to give you what's called a physiological dual chamber pacemaker. Thereafter, we connect the leads to a battery or a generator which sits in a pocket that is buried underneath your skin, just where I'm indicating here. And typically you will be given absorbable sutures.
Okay. Is that uncomfortable, walking around with a generator?
It can feel uncomfortable for the first 3 to 5 days. Most patients will get very used to the pacemaker very quickly. And although if you're very skinny, you might be able to feel a protruding device, which actually is smaller than the size of a matchbox. I would say probably that big, Mel, and the size of 3-pound coins or 2.5-pound coins stacked up. The thickness of the pacemaker is that thick, and the size is about that big. So probably 4 centimeters or 4.5 by 4 centimeters.
And what is life like for a person with a pacemaker? So what will they expect going forward? Do they have to keep coming to the hospital, for example?
Great question. In the modern day, we would normally return a patient with what's called a home monitor. And this is a really interesting device with a SIM card that you just put by your bedside table and you just plug it in. You don't even need Wi-Fi because the SIM card will connect to the cloud, and when you sleep in bed every night, you connect your pacemaker wirelessly to this box that automatically transmits the data to your central hub, which typically sits within the pacing department of your hospital. So follow-up for the pacemaker after the implant typically is a face-to-face for the first episode. So 4 to 6 weeks after implant, most hospital policies will get you in to inspect the wound to make sure you've set up your device properly. Thereafter, most follow-up is done remotely, which means you can be in your home. You'll get a telephone call once every 6 months or once every year to say your pacemaker is working fine, how are you feeling? If you're feeling that you could use a bit of oomph, for example, if your pacemaker doesn't get your heart rate up to a certain rate when you exercise, there can be programming tweaks which can continue to occur to make your pacemaker more responsive. So there are minor tweaks that can occur after the pacemaker are implanted, but this is not necessarily to prevent yourself from fainting.
Is there anything you can't do with a pacemaker?
So the pacemaker is a electrical device, and with all electrical devices, you may have interference from strong magnets. So what we would suggest is to avoid anything that can induce a very strong magnetic field. An MRI scan is one such device that you should always be cautious about. And before you attend for an MRI scan, you must tell the MRI technician that you have a pacemaker. Now, the pacemakers nowadays are perfectly safe with an MRI. So even if you need a cardiac MRI or a brain MRI scan, your pacemaker can be programmed into an MRI safe mode. The other things to be very careful of, which are very relevant in modern household appliances, would be an induction hob. So induction hobs can induce electrical currents, and therefore getting too close to an induction hob is not recommended, especially if you need a pacemaker working all the time for you to stop yourself fainting. So I would avoid an induction hob. The third thing, which is very uncommon, and I've only encountered 3 patients who do this for a living, is arc welding, which again induces a very strong electromagnetic field. But essentially, if you're unsure about your occupation or your hobbies, please ask your cardiologist about whether you can continue doing that.
Thank you. And last question, what are the risks of having a pacemaker?
The risks of having a pacemaker are very small, and they include most seriously a risk of pacemaker infection. And so when you come in for a pacemaker, you will be given intravenous antibiotics, typically just before you have the implant done. We used to give patients 5 days worth of oral antibiotics, but the latest guidelines have shown that that's not, we don't need to do that. And therefore we give you a single shot of antibiotics. Patients who then develop infection or can develop infection spread to the pacemaker at some interval afterwards, including 4 or 5 years afterwards, may then get an infection of the pacing lead or the pacing site. And that risk is less than 1%. So it's a very low risk. The other acute complications of a pacemaker may include bleeding around the lining of the heart, and that's called a pericardial effusion, which occurs less than 0.5% of the time, a small risk of what's called a pneumothorax, which is where there's a lung puncture, and so the lining of the lung separates with a layer of air around the lung sac. That again occurs less than 1% of cases. There is a risk, which is again less than 1%, of a lead displacement, which means the pacemaker's leads, when they're first put into the right and atrium and the right ventricle, in the first week need some time to embed within your tissue. And after a week, the growth of the heart tissue overlies the lead and anchors it down. Until that happens, a week to 10 days, we ask you to avoid any expansive movement. So for example, this movement, if your pacemaker is on the left arm is out, we want you to only move no higher than shoulder width. And we don't want you to be fixing things or building cupboards or lifting heavy things on your left-hand side for about 7 to 10 days afterwards to avoid that complication.
Thank you, Boone.
You're welcome. That was